This video is about intermittent self-catheterization. You are learning how to empty your bladder using a soft tube called a catheter because you are not able to urinate completely on your own. Intermittent means that the catheter does not stay in all of the time. This may be needed for days, weeks, or sometimes longer, depending on your situation. To start, collect your supplies and put them within easy reach. Warm water with a mild soap and a clean washcloth. A towel to sit on if you are doing this in your bed. A new catheter. And a water-based lubricant such as KY jelly. Do not use Vaseline. You may have been told to use a urine collection hat to measure any urine you collect. This is called your output. Lift the seat of your toilet and rest the collection hat on the rim of the bowl. Urinate into the hat. This is also called voiding. Then measure the urine by looking inside the hat to see which numbered mark it comes to. You will write the number down later. Empty the urine into the toilet. Wash your hands with soap and water for 20 seconds and dry them. You may wear disposable gloves after hand washing, but gloves are not required for self-catheterization. Separate the labia skin folds to clean the opening of the urethra with a soapy washcloth once, front to back. Gentle wipes called perineal wipes may be used instead of a washcloth. The single-use catheter may be pre-lubricated and have gel on it. If not, squeeze lubricating jelly onto the end of the catheter. Holding the labia apart, slide the lubricated catheter into the urethra. It is between the vagina and clitoris. Do not force the catheter. Gently and slowly guide the catheter in until urine flows, usually about 3 inches deep. Let all the urine drain into the hat until it stops. Then slowly pull the catheter out and place it in the trash. Check the level of urine from the catheter in the hat. This is called the post-void residual, or PVR. Empty the urine into the toilet and wash out the hat. If you are wearing gloves, take them off and put them in the trash. Wash your hands with soap and water for 20 seconds and dry them. Using your output record, write down how much urine you voided naturally, and then your post-void residual, or PVR, which is how much you collected with the catheter. Call your doctor if the catheter will not drain, for pain or redness at the catheter site, and for other signs of infection such as fever, chills, back pain, bleeding, or if the urine has a bad odor. When you are trying to catheterize, stop and call your doctor if you can't get the catheter to go in far enough and you can't empty your bladder. This video is intended as a tool to help you better understand the care instructions that you have been given. It is not intended to replace any specific advice or personal care instructions that you have received from your care team. If you have any questions or problems, please be sure to call or be seen.